So wanted to touch on the story that started the show today when I asked the question about the government really kind of leaving it now, apparently everything up to us in terms of the fight against COVID. And I said, it's interesting because as I said that, during the break, a commercial came on from the government of Quebec letting us know that you should, update your boosters, get your shot if it's been more than 5 months. And I thought to myself, and I said as much, that's all well and good, but I think this has been going on for so long, those kind of commercials just tend to go in one ear and out the other. Right? People have heard them. They already made up their minds as to what to do. And I suggested simply that, what we need to do, right, is go back to holding those press conferences with public health where everybody pays attention and the government again brings us up to date on what's going on. That's what has to happen. So I wanted to get a take. Aaron, we're going to try to get through to Aaron DERFEL. We're having a bit of trouble with that right now. But Dr. Chris LABOS is on the line. Dr. LABOS, let's start with that first, the issue of these numbers, which we don't talk about every day, and I think too many people assume that by virtue of that, this is going away. Numbers show us, in fact, that it's doing exactly the opposite. Am I right?
Right, you are. And here's the problem. If you actually look at the numbers and look at the course of the disease over this entire pandemic, the numbers never actually went down after Omicron started end of November, December of 2021. Previously, whenever there was a wave, the numbers would come back down again. I mean, there were times when we had very little COVID going around, like almost zero COVID at many times. But ever since the Omicron variant came and then all the subvariants afterwards, the numbers never went down again. We just sort of plateaued at sort of these high peaks, these high levels. And what we're seeing now is that, as expected, unfortunately, as the weather is getting cooler, as school started, as people are spending more time indoors, all the numbers are starting to go up again. So there is an indication that things are starting to get a little bit worse and that there is the potential, at least, for things to go up and get significantly worse for the healthcare system and for people who are, especially at risk for the complications of COVID.
All right, let me go to Aaron DERFEL for a second. Aaron, you posted a thread on this just over, I guess, the last 24 to 48 hours. And I think the one thing that really struck me was we tend to forget. That's what people do, right? It's not in the news today or this week. We tend to forget about it. What was the situation exactly a year ago, compared to what it is now as far as COVID goes?
Okay, so as of Friday, there were 290. Well, a year ago, there were roughly about 300 hospitalizations due to COVID in Quebec, and as of Friday, in contrast, were 1,829. So it gives you an idea, and that would be the same. Like this time last year, would be people hospitalized with COVID, and people hospitalized because of COVID.
Okay, and I want to just understand. I want people to understand. A year ago, when we were in the middle of all this and we saw numbers, as you just said, that were literally a fraction of what they are now, and now nobody's really talking about this anymore, and that's obviously a concern.
Yeah, I think what happened is that the Omicron wave hit Quebec in December and January, and you'll recall in January and February there was a huge wave, the biggest wave of hospitalizations to date in the pandemic, and since then, we've seen these subvariants that have emerged. In the UK, there's this subvariant of Omicron called BQ.1.1 that's responsible for the hospitalizations. We have this subvariant in Canada, but what's driving the latest wave is BA5 and BA4. Wait, what happens when BQ.1.1 becomes quite prevalent?
So, Dr. LABOS, I want to go to you now because the other issue that's come up now is the fact that, and I mentioned, we got a note from a texter saying that at the Vic, for example, there were 235% capacity. Now, those are not obviously all COVID cases, but they are an indication, are they not, that with increasing COVID cases, we're seeing exactly what we don't want to have happen. People going for one reason who simply have to wait hours and hours because COVID patients are still getting into hospitals.
Right, and here's the thing. People don't realize that everything sort of spirals outwards when things start to worsen. So you have COVID. You also are having, the beginnings of flu season. Flu season typically starts late in the fall, so November, December. So if you have multiple people showing up to the hospital for multiple reasons, there's only a finite number of beds, and our capacity to increase and to accommodate more people is actually worse now than it was before because a lot of people have left the profession, have left the system, and so personnel shortages make it harder to accommodate. Our healthcare system is stressed at the best of times during the winter months because of the flu. So for everybody who says, well, this is just like a bad flu, let's not forget that the flu is very, very bad for our healthcare system. If you've ever had to call the hospital during cold and flu season, you usually get an automated message saying, because of the flu, we have long wait times. Please don't show up to the emergency room for, minor issues. So if you have the flu and you have COVID on top of that, that overwhelms the emergency rooms in the healthcare system, and then you can't find a bed when you have a heart attack or you need cancer treatment or something of that kind. So there is a ripple effect to all of this. And so, a lot of people think, well, COVID's not going to affect me. I'm young and healthy. I got vaccinated. I don't have to care anymore. Well, you have to care a little bit, because when the healthcare system starts to fall apart, that starts to affect even non-COVID treatments and even non-COVID care.
So, Aaron, I want to go back to your tweet, and you've been on top of this, obviously, since the get-go. I said maybe it's time. Yes, the government is running commercials, but as I said, they kind of go in one ear and out the other these days. Is there a reason why the government is not necessarily spending the time? And I'm going to say, okay, the election's over. And I hate to think it had anything to do with that, but let's not be naive. It's done. What should be happening now? I mean, a year ago, we were still getting, press conferences held by public health. And really, they happen almost never these days, even though the numbers are bad.
Well, we've seen this time and again throughout this pandemic, this kind of institutional inertia. Reading between the lines, what I've been able to piece together, I think that they're taking their cue from the Chief Public Health Officer, Dr. Luc Boileau, who is suggesting, yes, what we're facing right now might not necessarily be an eighth wave. It's more of an oscillation, and in his opinion, it's not so severe because we're not seeing a game-changing subvariant, in his words. And so I think that that he might be regrettably instilling a false sense of security. The other thing that I want to raise is that the Education Ministry has been collecting data on school absences as a result of COVID since September 6th, and it hasn't released that data. It should release the data. Let's say the data shows there aren't many absences. That would be reassuring. By not releasing the data, what it does is it fuels mistrust in the government.
You see, and I brought this up because I read that in your post as well. So we had started talking, and Dr. LABOS, I think we spoke at the time as well, kids going back to school, it'll be only normal to assume that we would still have, some COVID outbreaks. But as Aaron just said, that data has not been released. It's been basically over a month now. How troubling is that?
Well, it is a little bit because, you can't ask people to make their own decisions. Because now the watchword really has been, well, make your own decisions, look at the data and judge your own risk. But you can't judge your own risk if you don't know what the situation is like. So, because we're not getting, so here's the thing, like when you want to talk about wastewater data, when you want to look at, the daily numbers, the hospitalizations, the numbers are there. You can find them, but they're not easy to find. The average person is not going to go start scouring the government websites to look at the relevant numbers and plot them and trend them over time to see how things are evolving. So if you want people to make their own educated decisions about their risk, you have to give them the data to do so. And if you're starting to see indications from wastewater data and from everything showing an increase, well, you have to tell people that, and you have to make sure that that message is cutting through the noise, because unfortunately we live in an era where there is a lot of noise and getting people's attention is hard. And if the government wants people to do the right thing, and I do believe that they do, because they are still telling people, masks are important, wear a mask in an indoor space, get your boosters. Well, you have to show people why that's important. You have to show people why we're seeing the numbers going up. And if you're not going to tell people what's happening in schools, well, you're not giving parents the information to know, why they should get their kids vaccinated or get their kids have a booster if they're eligible to do so.
Aaron, are you hearing?
I would actually add, with all due respect, Dr. Leos, that the government, and this is the case for jurisdictions around most of the world, they're sending out mixed messaging. They're sending, yes, get your booster, and it's good to wear a mask in a crowded gathering. But then, they're not releasing the data, and Dr. Boileau was saying that, no, I wouldn't call this, an eighth wave. So we're getting this conflicting information at a time when, the authorities around the world have eased restrictions, and politically, authorities have decided that this pandemic is over. But we're seeing that the subvariants, it's not over. And as you mentioned very astutely a moment ago, what happens is the cumulative of this pandemic interferes in the care of patients who need hospitals for non-COVID purposes.
Yeah, so to that point, Dr. Labos, you're on the ground. Is that what you're still seeing? The backlogs are still there. Are they getting better? Are they getting worse?
I mean, subjectively, it seems to me that wait times for testing are getting worse. It fluctuates, right? It goes up and down, but I think most people would be surprised. Like when you tell people, I'm going to order this test, that test, and they say, well, how long is it going to take before I get called? And, most people think it's going to be a few weeks, and they're usually genuinely surprised that we usually measure these things in terms of months, not weeks. So I think most people, and this is, I think, part of the reason why complacency is built in, people don't really understand the delays inherent in the medical system now. So, if you haven't been sick, if you've never had a real medical condition needed testing, you may not fully realize that when you need something, you may not be able to get that for months just because of the backlogs. I mean, it's hard for people to understand what it means to be on a waiting list, waiting a year to have a hip replacement or to get cataract surgery or something like that, because these are the realities of the wait times that we're often dealing with.
And they are exacerbated by the number of people ending up in hospital because of COVID?
Well, they're exacerbated because of, yes, if you can't get a hospital bed, also the lack of personnel. A lot of surgeries have to get canceled because there's just no personnel around, because you don't just need a surgeon to perform an operation. You need nurses, you need technicians, you need operating room staff. So all of these things start to cause ripple effects. So, once as the demand goes up and as the supply remains steady or even goes down, the wait lists just become longer and longer and longer. And then as that happens, it becomes harder and harder to address the issue.
I'm going to run out of time. Aaron, just really quickly, do you get a sense that anything will change here? I mean, we don't even know who the new education minister necessarily is going to be. Some of us can hope it's not going to be Jean-François Robert. Do you think anything changes here?
I think things will change if and when, this wave of hospitalizations becomes critical in the sense that we see a lot more ICU stays and they have to resume that data status. Once they see that, when we start crossing over into 23, 24, 2,500 hospitalizations, then the government belatedly will hold a news conference to say, perhaps we should start wearing masks in public again.
Hard to think we have to go back there again. Gentlemen, thank you both. Aaron, appreciate it. Dr. Labos, thanks so much for your time.
My pleasure.